For those that don't know me, oh, there we go. Okay. For those that don't know me, I'm Brian Raymer. I'm in the Department of Family and Community Medicine. I'm on the leadership team for the Excel program and co-director for the Excel Community Engagement and Outreach component. It's my privilege to be here today to talk to you about the ACE Awards and answer any questions that you may have. If I can't answer them, hopefully somebody in the room can. And if they can't answer them, then you can submit them online and we'll try to find the best answer for you. So just quickly, we've got a pretty good showing, and some folks I know are on the phone and on Blue Jeans. I just want to go quickly around the room with name and what institution you're from, because I see some faces from other places, which is great. So we'll start down here.
Kristen Isaac from Christiana Care from the CEO component. Jen Passarella from the CEO component.
Steve Martin from the Center for Drug and Health Studies at UD.
Eileen Sparling from the Center for Disability Studies at UD. Nicole Philland from the Center for Research and Education and Social Policy at UD.
Sure.
Denise Taylor, Christiana Care.
Gina Overson, co-author Behavioral Health and Nutrition.
Xiaoqing Chai, Behavioral Health and Nutrition at UD.
Dan Thompson.
Sima Sona with the mentoring KCA.
Jacqueline Ortiz from the Center for Diversity, Inclusion, Cultural Competence, and Academic Diversity.
Kristen Maida from the Mars.
Melissa Melby, Medical Anthropology at UD.
Ian Wang from Mechanical Engineering of UD.
Great.
Claude Kratowicz, Christian Care, part of the EpiBiostat cohort, with the CTR.
So Gu Zhang from Christiana Care.
Lee?
Lee McCormick from the CEO component.
Great, thanks. We got about 16 people on the phone, I'm told. So just quickly, we'll go through the roll on the phone. Name and institution. It'll be a free for all. So we'll see how good you guys can do.
Tell them unmute their mic.
Unmute your mic to talk.
Hi, it's Beth Bradley from Christiana Care.
Hi, Beth.
Hi, it's Beth Ortega-Smith from University of Delaware, Behavioral Health and Nutrition.
Carolyn Jenkins, Medical University of South Carolina.
Hi, Carolyn.
And Ranwala, Medical University of South Carolina.
Next up.
Erin Knight from the University of Delaware.
Hi, Erin. Next. If you talk at the same time, I don't think the world's going to blow up. So go ahead. All right, great. So we got some anonymous folks. That's fine. We can see your phone numbers. Anyway. Not the NSA, sorry. All right, so today's agenda, for those of you that have the PowerPoint or online right now, we're going to talk a little bit about the ACE frequently asked questions, have some question and answer session for the ACE Awards specifically after that. We're going to talk briefly about the Bio and Epi core, the Biostats and Epidemiology core, with some question and answers, and then the Mentoring core as well. And we have representatives here from those cores, which is great. So just quickly, going into the new season for the ACE Awards, a brief overview of what the ACE Awards are. We've had gracious support and collaboration with Carolyn Jenkins and others at the Medical University of South Carolina who have implemented a similar program for a number of years through their sector program, which is the CTSA program. And the ACE Awards is an academic and community engagement program that's really designed to get researchers from the academic settings or clinical researchers engaged with community partners to churn out innovative community-based participatory research and community-engaged research projects that will be best suited to turn into larger scale research opportunities, whether it's through the NIH or through other funding mechanisms like the CDC or HRSA or AHRQ and so forth. We completed the first year. We had 3 awardee teams, and the curriculum for that first year was good, and we've refined it a little bit, and hopefully it'll be even better for the second year. Really what we're trying to do here is establish an opportunity to create infrastructure so that folks can better understand how to connect with each other across sort of organizations, departments, silos, all that good stuff. What we're really interested in doing here is fostering long-term relationships so that the type of research that's being conducted through the Excel program and elsewhere is really meaningful, both from a theoretical and sort of conceptual purpose as well as a practical purpose. So our community partners are a really strong and engaged group that want to help the academic community push the boundaries as far as research applicability goes. So that being said, the goals here are really to conduct pilot community engaged research projects, create and expand community academic research partnerships. Some of you in the room and on the phone may have experience in community academic research partnerships or other sort of programmatic or implementation partnerships, and that's great. We want to really create an opportunity to foment that into more established and long-term relationships. Develop strong community engaged research proposals, and that's what the curriculum itself is designed to do, and we'll talk a little bit about that more in a few slides here, and to promote subsequent research funding, projects, and of course publications, because everybody loves those. And really our community partners are really interested and actively engaged in helping us disseminate the information that's generated through these research projects and hopefully expanding the type of impact that this research can have in both practice and policy. So we'll go down here. Our vision is really to improve outcomes that matter to patients and communities, and we can't do that unless there's really effective partnerships between our research teams and our communities of patients and organizations and so forth. Why are the ACE Awards needed? That's a good question, but we know that a lot of the research that's conducted now is from a translational spectrum kind of loses its impact at a certain point. And what we're trying to do here is really make sure that that we can create a foundation to explore opportunities in community engaged and patient-centered outcomes research. Some of you are familiar with PCORI and other funding, newly established funding, relatively newly established funding mechanisms that emphasize patient-centeredness and community engagement. And so that's really what we're trying to foster here with the ACE Awards. How can you apply? Well, if you go to the Excel website, and just a show of hands in the room, how many have been to the Excel website so far? Great. How many have created a profile on the Excel website? Little less. That's good. I encourage everybody to do so because you're not going to be able to apply unless you create a profile. So that's step one if you haven't done it yet. Go to dectr.org. And there's going to be 2 options. There's going to be a research side and a community side. You'll go to the community side and you'll find the ACE Awards there. Once you're registered and logged into the website, you'll have the opportunity to actually apply. And Jen Passarella let me know that there is a REDCap form. It's a sort of embedded survey form that's built into the website now for a letter of intent. It's highly encouraged that you complete the letter of intent. It's brief. There's just some information in there about who, what, where, when, and why, and an opportunity to ask questions. That letter of intent is due July 1. Okay, you'll see that the next frequently asked question is when's the application due, and that's August 10th. So that's when we'll be looking for them. And of course, between now and then, any questions that come up, any issues that you have with the website and so forth, you can email the Excel CEO email contact. And again, that's on the frequently asked questions form as well. How will you find out if you won an award? Well, after all of the applications are reviewed by the ACE Award Committee and the Excel executive team, decisions will be made, and you will get an email or a phone call sometime in October of 2015.
Can someone
Sure, I'm sorry?
Gail, she's gonna walk.
Yeah, she's walking. That's cool. She's got her phone or laptop or whatever it might be. That's great.
Yeah.
Wait, she's on her camera. Okay. Yeah, we can see it. Yeah. How? Okay. So she corrected that. That's good. So how much is the award for? The awards are going to vary depending on the proposal and budgetary request for that proposal, but typically the awards will be between $15,000 and $20,000 for the pilot proposal, and we're looking to fund at least 4 proposals this year. If we have the budget to fund more than 4, or if some proposals come in under the $15,000 to $20,000 mark, which I don't really envision will happen, we might fund more than that, but we're looking to fund at least 4. What if I can't find a research or a community partner? Well, this is Delaware, so you don't have to look too hard to find a research or a community partner, but we know that it can be difficult, and that one of the issues that we've had in the past is we do have a lot of really engaged community partners who are looking to take advantage of finding out whether or not their programs in their community organizations are working, how well are they working, what's best for their constituency or the people that they serve with their programs. What's been fairly difficult is getting them formally tied up with an academic researcher. So I'm calling on the academic researchers in the room and all of your colleagues and friends that may be interested in doing this to please help us get the word out, that this opportunity is available and that we do have a lot of interest from our community partners in engaging in this. Now, we do need an academic partner in order to make this happen. So community organizations or community investigators can't just apply on their own. They're going to need representation from one of the 4 institutions that are associated with the Excel program. That's the University of Delaware, Christiana Care, Nemours, or the Medical University of South Carolina. So again, if you have any problems with that or don't quite know where your interest, whether it's your own particular research agenda, or if you're a community partner where your interests align with the researcher's interest, please contact us and we'll do our best to help facilitate that. There's the email, excelceo@dectr.org. That's where you can go for assistance, or many of you have my phone number or Jen's phone number or Kristen's phone number. Please feel free to call us. We can walk you through or talk you through pretty much anything related to the proposal. The curriculum, if I might say so, it's a great curriculum. I had the opportunity, the privilege to participate in the first year's curriculum, as did some of the others in the room and perhaps on the phone. I can vouch and say that it was well done and learned a lot. So it's about 10 weeks, and it covers the basic research skills needed to conduct community-engaged research, touches on qualitative and quantitative methods, research design, principles of partnership building, evaluation, and so forth. And really it's there to help focus the teams of researchers in better refining their proposal so that they can be better suited to reach not only the goals of their pilot project, but also subsequent funding at a larger scale. That being said, it is 10 weeks and it's time consuming, it's time intensive, but I think it's absolutely worth it. So again, please think about that as you build into your interest for the ACE Awards moving
May I ask
forward.
a question?
Sure.
So for the curriculum, is this a 10-week of full-time training, or is it just a couple hours training? So basically.
Yeah.
Is it only open for the awardees, or is it open for everyone?
So everybody that applies has the opportunity to go through the curriculum. Okay. And so it's really designed to take the interest of the applications that were submitted and refine them, help the teams of researchers, the academic researcher and the community researcher, refine those applications to be much better suited to achieve larger scale funding once that pilot is over with. Okay, and to answer your first question, it's not full time. It's about an hour and a half to some sessions might be up to 3 hours, but that's going to be dependent. Yeah.
Per week.
Yeah, per week for about 10 weeks. Yeah.
Okay.
Yes.
In terms of scheduling, since some of us are academics and have
Absolutely.
our own classes to teach, how does that work generally?
How does that work? Well, we try to be as flexible as possible. We've been doing it. I think what was it, 9 to about 11:30 on Wednesdays during that 10-week session. We will try, once the submissions come in, we will try to get some level of consensus from the teams to figure out when the best opportunities for scheduling that is. Now, we are asking that both the academic investigator and the community investigator, we could be a team of 4 people, but at least one of each of those folks come together for the curriculum sessions. And we'll leave that up to the teams themselves to work out between them for any particular week. And we have blue jeans as well, as you can tell. So, we have had individuals who couldn't be there in person participate via the video conferencing. I found that the in-person, the ability to really interact with one another was helpful, not just from the curriculum standpoint, but even working with other teams, figuring out the problems that they're having or issues that they can help you with, in the process. And that was really great. So before we get to the questions, the really critical note here, the funding will only be released for the pilots after the successful completion of the curriculum course. So at a minimum, the academic investigator and the community investigator should attend. Other team members are welcomed and encouraged. And if there are other team members, of course, if there's scheduling conflicts within teams, you guys can work it out as best as possible to see who can come in. There's key contacts down here. Dr. Heather Bittner-Fagan, who unfortunately couldn't be with us today. Her information is down there, as well as Jen's and Kristen's. And again, that excelceo@dectr.org email goes to a couple people on the team, and they'll be able to answer your questions pretty quickly. So with that being said, let's get to the key dates. April 20th, the call for proposals went up on the website. Today is our meeting for key questions and so forth. May 18th is our annual conference for the CEO component, and that's titled Learning from Each Other, Building Academic Provider Community Partnerships for Research. Okay, highly encourage everybody to attend. Again, registration is available on the website. July 1st, the letter of intent for the ACE Awards is due. August 10th, the proposals are due. Notice of awards goes out in October, sometime hopefully in the first half of that month. November 5th is when the required curriculum is going to begin, and there's a couple of asterisks after that. I'm not keen on what those asterisks mean at this point. Maybe it'll be on the following page. Is that tentative? It's in the CFP. Okay, it's in the CFP, okay. February 2016, the curriculum will complete, and at the end of the curriculum, IRB proposals are approved and your projects can begin. Again, if we'll help you work with your own institution's IRB to once you get those proposals refined, to get those in and submitted and work through that process. Now to the good part. Any questions? Yes.
I'm not sure, this is the first time, right? What is defined as a community investigator? So if I'm a, investigator from university, so my partner should be working in a hospital or, physician, or, how you define community investigator?
So that's a good question. And again, I think we'll leave it up to your purview, but what we like to see are community participants from outside of the academic or clinical institutions where you're working. So, or it could be somebody within your institution, let's say at the University of Delaware, for instance, as a professor or a faculty member, you are interested in doing research around barriers to physical activity for older adults or something like that, right? And you find out that somebody in an administrative position in one of the centers or something like that is interested in the same research. I would classify that person, if they're not a faculty member, as a community investigator if they're interested in working with you. I'd also encourage you to think outside of your institution as much as possible to identify individuals who may be working in that setting or working with individuals who might end up being enrolled in your pilot project, to help in that process. So again, community investigators, I would say at this point, non-faculty member or non-clinical investigators. I'm sorry, go ahead, Dr. Sharif.
It could be someone who basically represents, the stakeholder who would be, the beneficiary of whatever project you're thinking of. Like whoever is supposed to be benefiting, someone that represents that point of view. And sometimes it's hard to think about, what that might be. So reach out to us and we can, talk about the project.
So you have 3 projects already talked. Can you give us the example of the 3 funded projects?
Yeah, sure. So actually, we have some of the investigators in the room. Steve, do you want to talk a little bit about your project and what you guys are doing?
Okay, our project is working with the Center for Disabilities and with the disability community in Delaware to extend the use of, in our case, the youth tobacco survey to administer it to people who haven't been included in the past. So it's to include this proposal will increase Delaware's ability for surveillance and give us some new data for potential programming related to, in our case, tobacco usage and tobacco cessation. It's also a mechanism for extending the use of surveys to targeted population.
Great, yeah. And there's also a project that's being run by Mike McKenzie, who's a faculty member at UD in behavioral nutrition sciences, and Sean Hibble, right? Yeah, who is the director of the Cancer Support Network in Delaware. And Mike and Sean are interested in looking at the influence of physical activity on survivorship and the partnerships that exist in that sort of space for cancer, people who have cancer. So, and then the third project I happen to be working on with Liz O'Neill and Nora Katorkis in the Cancer Center, the Helen F. Graham Cancer Center over here, which is designed to engage community health workers in understanding the value of their work by community members, patients, and families who were served by community health workers throughout the state of Delaware. And that's a sort of a mixed methods approach.
This is 3 projects. Who are the community investigators? So the second one I got is Sean. That's the network support group, right? Mm-hmm. So in your project, who is the?
Yeah, Liz O'Neill is a project director for the Center of Excellence in Women's Health at Christiana Care. She's been running that project for a decade now, maybe, and they have a community health worker program, health ambassador program that's run through that network. So she's sort of the liaison for that, as well as Nora Katorkis, who actually is a community health outreach nurse in the Cancer Center, who has been for many, many years embedded in the community doing cancer outreach for screenings and so forth. But she's not a researcher per se. So those are the community partners in that regard.
And in our project, Steve is the academic investigator at the Center for Drug and Health Studies, and Liz and I are both considered community investigators. I'm at the Center for Disability Studies, and she's at the Division of Public Health.
But we also have a board too.
Right, we have an advisory panel that's
made up with a number of people from education
and some disability advocacy groups and schools.
Okay.
We pull more people in that way for the community. We're sort of community, but we're also sort of on the research side, so we play dual roles, but we're trying to engage people in the decision process who are more advocates.
So we're getting a little feedback. Feedback, right? We're getting some feedback from our friends on the phone and colleagues on the phone saying that they can't really hear the question. So I'm just going to restate that. The question was brought up, how do you define community investigator? And so some examples were given for the currently funded ACE Awards projects. To make a long story short, what we're looking at are sort of non-faculty member folks who are considered the stakeholders for whatever population of interest the study is looking to interact with. So we've got folks who run centers at the University of Delaware, for instance. We have folks from public health, Division of Public Health, who have critical insight into specific populations and with disabilities. We have folks who are running cancer support networks and folks who are doing community outreach through the hospital setting and so forth. Do we have any questions on the phone at this point or on Blue Jeans? Any questions on the phone or Blue Jeans? If you're on Blue Jeans, you can use the chat function as well to ask your question. Any questions in the room? Any more questions in the room? More than happy to try to answer them. People digesting a little bit. Okay. I'm going to ask Claudine to talk a little bit about the epidemiological and biostats core, because there is support through the Excel program that can be utilized by folks who are interested in engaging in the ACE Awards program. So please welcome Claudine.
Yeah, one question.
Oh, I'm sorry.
One question from the chat. Any limitations on what can and cannot be budgeted in the grant?
Yeah, so investigator time is not budgeted in the grant. So just to be very clear about that, it's not budgeted in any of the Excel funding opportunities. So either the pilot grant or the ACE Awards. So investigator time is not budgeted, but you can budget things like stipends for travel, research assistance if you need to hire folks to help you out on your project. And the research assistants can, again, they don't have to be graduate students. That would be great, but they could be folks from the community who are interested in helping out with the study or have critical insights into the population that you're serving. You can buy equipment that you might need to conduct the study, software, those sorts of things. But the only real limitation, I believe at this point, is actual time. Yeah, for both investigators. Please, Claudine. Yep.
So thank you very much for being here, everyone. I'm Claudine Jurkowicz. I'm a physician epidemiologist in the Value Institute here at Christiana Care, and I'm also part of the EP Biostat core for the Axel CTR. So I have a couple of slides here just to describe what is offered by our core. So we propose assistance for proposal development, database development, RedCap, which I'm sure many of you are familiar with. It's a database system and with a data entry, very easy, very intuitive data entry system. And we can help on how to set up RedCap if you need to do a survey or any type of database work with data that you are collecting prospectively. We assist for, we provide assistance, so we give advice for statistical analysis, and we also help on manuscript preparation if you need any help, mostly on the methods and a description of results. Our biostatistical services include to help with study plan and conduct, which means we can help with study design, selection of variables, development of statistical analysis plan, estimation of sample size, very important, and power calculations for your grant, randomization schemes once your grant is funded, and interim analysis while you are doing the data collection. We can help with data processing, meaning data validation, statistical analysis again, and interpretation of results, as well as publication and presentation. We can help with formatting presentation of results and help with the writing of abstracts, manuscripts, and presentations again. So here's what I have. I have a little example of what the Excel website is. So, but most of you are already registered, so it's not unknown. So it's for someone who's never registered. So what is important first is to register. That's the extreme right on the slide. Once you are registered, you arrive on this page, and to request our services, you have to click on the AP Biostat request. That's the blue square here. So you click there, and then there is a form that is coming up from the website, and obviously you need to provide some information about yourself. Whether it's already an Excel sponsored or proposed project. So here, since it will be a new project, you would say no. And then you give some information about your project, whether it's funded or unfunded. Well, in your case, that would be unfunded. And if you can, whether the project, what type of project is it? Is it a case control study, a cohort study? The type of study that you are interested in doing, or maybe you don't know yet and you want some advice about the design, so you would put uncertain. And there is some more questions about your request, what type of help you need, and you may want help just for grant proposal. That would be the case. And I'd like to remind everybody that, in fact, in this session, in this application, request to the AP Biostat core is compulsory. You have to do it. And we would like to have every request at least 2 weeks in advance so that we can really help you, appropriately for study design and put together the application. Mostly study design and power calculation. And there is also a question regarding the deliverables. So here, that would be obtain funding. And then you just submit your requested deadline and submit. That's it. So it's a very easy form to navigate once you have registered again and you have to log in into the website. I think that's all I have. Questions? Yes?
So, for example, if I send the request, usually how, are we going to just continue online or, set up an in-person meeting? How the data transfer, those things happen.
Okay. Yeah, so the question is, once the request is sent, how will the interaction continue? What will be the interaction? I think it will really depend on your project. Most of the time, we receive requests on a regular basis for any type of questions. And most of the time, so we review the request once a week. So that's why it's really important, for us to have them in advance. We review the request as a group. All the people who belong to the AP Biostat core review the request. And then we assign the request to someone. And this person who would be the most fitted with your project would contact you and set up, whatever, a phone conversation, a meeting. You will discuss with a person of the AP Biostat core what's your project, and then you can, you can go from there. So there is no strict rules, but one person will contact you anyway as soon as we've decided who will be this person.
So are those services free?
Yes. Yes. The services are free. Sorry. Yeah, the question was, are the services free? Yes, the services are free. So the services for preparation of the grant and the services for the grant, for the pilot grants are free. If you apply to a much bigger NIH grant, that's when we expect you to include our statistical services into the grant as a part of the budget. But that's the next step. But anything related to preparing your pilot grant and running your pilot grant is free. Any other question? Any question on blue jeans?
I have a follow-up question. For
Sure.
publications, for example, I already done some studies and in a paper, we need to address some statistical analysis, review comments. And for that type of service, are those also
free? So the question is,
borderline.
For publication, statistical analysis related to publication projects, yes, they are free. As long as you come to the request and you are part of the institutions of the Axel CTR. So it's free. It's part of our services.
And you cite yourself.
Oh yeah, and of course, I mean, we expect to be cited.
I mean, it's funded by the grant.
Yes,
right.
Yeah.
Okay. Absolutely.
Free to the user.
Right. Other question? Great. Thank you.
Thanks, Claudine. Okay. Next, we're going to talk briefly about the Mentoring Education and Career Development Corps, known as the MedCorps. Seema, do you want to talk about that? Dr. Sonat's coming up to speak about the MedCorps.
I have no slides because I'm just incapable of being that formal sometimes. So the MedCorps, as it says, is the part of the CTR that focuses on mentoring and education career development. So particularly research mentoring and establishing those relationships. So having a mentor and a mentoring plan and a mentoring relationship are required for all of the pilot grants that CTR funds. So the ACE Awards, the pilot grants, the MRDAs, all of those things require mentoring. And because there's quite a lot of information that suggests that people with mentors make much better progress as researchers than people without mentors. And since one of the goals of the CTR, the biggest goal of the CTR is to have all these institutions make progress in their research portfolios, mentoring is very important to that. So when you actually are preparing, again, when you're preparing to write and submit your grant, we would ask that you contact us. The contact for the mentoring corps is Erin Regal. If you go onto the website and do the mentoring contact form, it will go to Erin. But if you're otherwise, it's Erin Regal at Nemours. You can find her and email her. There is on the website, although I don't know if it's yet on the ACE Awards part of the website, so that might have to happen, a mentoring plan, a template for a mentoring plan. And so we will require that you fill out the mentoring plan template because unlike your biostatistical plan, which is kind of part of your grant, right, and you kind of write the biostatistics into the grant, you don't necessarily, and we wouldn't expect you to, write the mentoring into the grant. The mentoring plan is kind of a standalone document. But the template for the mentoring plan says what needs to be included in terms of what is expected, which is a frequency of meetings, the type of expertise the mentor is providing, the prior qualifications of the mentor, not as a scientist only, but as a mentor. Like what have other people that they have mentored gone on to do successfully, and so on. And so, so that's what we're looking at in terms of the suitability of mentoring for your grant. We can help you find mentors. So if you don't know who the right mentor might be, we can connect you to people across institutions. For the ACE award, we feel it's slightly less important that you have a mentor at your institution. For the other awards, for the MRDAs and the pilot, we sort of say your content, right? The scientific mentor could be from anywhere, but you need a career mentor from your own institution, because even though we're a collaborative group of institutions, the culture and the needs for progress and the politics of success are very different at each institution. And so it's important that you have a mentor that understands the landscape of the institution that you're in. For these community awards, that's somewhat less important, because what's key is that you can do the proper research in the community setting. And if this is going to be a key part of your career, then we're going to suggest to you that you also get a mentor at your own institution. But for the purposes of getting the ACE award, we're not going to hold you to that the way we would for the MRDA and the pilot grants. So we need to see, and some of this we need to hash out with the CEO leadership too. So what we would need, we tried evaluating mentoring plans when people would just send us the mentoring plan, but it turns out that if we had no idea what they were doing, it was astonishingly hard to figure out if the mentoring was going to be suitable or not. And like I remember saying to Claudine, well, Claudine, you don't have anybody that can do your, can actually help you with the data piece of her big data pilot grant. And she's like, well, but my co-investigator is, Hagit over at UDEL, who totally knows everything about that. And I was like, oh, well, okay, fine. But I didn't know that, because all I had was her mentoring plan. And like, her mentor is a very good scientist, but isn't necessarily an expert in that particular, right, in the technical aspects of what she was doing. And so that's why we're actually asking, not for the full grant, because we understand that you have to have these approved before you submit it, but essentially an abstract, something that says, this is what we're going to do, this is kind of where we're going to do it, this is the rest of the team, right, and this is how we're going to work together, and then the mentoring plan, that this is what the mentor will do, and so on. And then also a letter of support from your mentor, and anyone who can be your mentor should be able to write a letter of support. Anyone who's a mentor has written 1,000 of them by the time, they get to sort of mentoring at this stage. So that's basically what we'll want is a preface of your grant, which is just what you're doing, kind of where you're doing it, and with whom you're doing it, and then your mentor's CV or biosketch, as well as their prior mentoring success. And then as I said, if you need help finding these mentors, we can help you do that. But we can also help you evaluate whether a current mentoring relationship will be sufficient in the context of this grant. So, questions?
How far in advance would you like them to get the mentoring plan to you before they submit?
There are dates about that, aren't there? Are there not?
No, but I think for those of you who kind of know who or have identified a mentor, it's probably easier to put that together with the rest of your submission when you're sending that in. If you don't know, I would encourage you, and you need help identifying somebody, I would encourage you to reach out as soon as possible.
Right. But the only thing that I will say about it is that if we don't think your mentoring plan is adequate, and you just wait until you submit your whole proposal, we may just say to these guys when they're reviewing it, we think this mentoring plan is completely inadequate. Don't fund these people. I mean, right? Because that really is a piece of it for these, more junior investigators that we believe that, that the role of the mentor is very key in the success of the project. And if the mentor and or the mentorship plan are insufficient, then our recommendation is to not go forward with the project. There's opportunity to remediate that. We've certainly had cases where very good experienced mentors have, because they were busy or having another grant of their own due or something, have written pretty feeble mentoring plans for something, and we've sort of said, we know they can do better, here, do this again. And, and so that's a different thing. But if it's really significantly weak, or if you have any concerns about it, I wouldn't wait and submit it with the grant.
Right. I think we do have to be pretty honest as well about sort of the lack of depth in our bench in Delaware, so to speak, as far as community engaged researchers or folks who have built a career out of community engaged research. It just doesn't really exist in Delaware. We don't have a school of public health here where that's traditionally found. We don't have an academic medical center with a couple of teaching hospitals. But so again, there may be a need to piece together your mentorship in terms of.
No, absolutely. I mean, we suggest in general, for most of the grants that have been funded outside of ACE, there are mentoring teams.
Right.
And there may be a content mentor, a career mentor, there may be peer mentors who aren't senior people but have a specific bit of expertise for something you need in a specific technique or survey skill or ethnographic something or content, whatever it is. And so we don't it isn't this idea that someone will be the primary mentor.
So your likelihood of being funded on this is going to be much, much higher if you start very, very early in identifying your mentor and reach out to us, because we're all here to really help.
Yeah.
So both from CEO and from the mentoring
right.
core, we can help you connect.
And and especially MUSC has a few more people down there than we have up here, and so they're a partner, so we can connect you with folks down there. And then, I'm not sure how the ACE Awards think about it, but we've even said if you have strong sort of career and scientific mentors within Delaware or within the CTR, and you need a content mentor from outside, that's okay. Like if your content mentor has to be from Penn or Hopkins or UCSF, which I know where they do a lot of this stuff, or whatever, that's okay.
So Jeremy on Blue Jeans asked to clarify if the mentoring plan is targeted towards the AI, CI, or both.
So primarily towards the AI, because the AI is going to be the eventual PI on federally funded grants, and because that's the focus of the CTR, the mentoring is primarily targeted to the AI. Now, of course, we would hope that the mentors will be working with the team, but the mentoring plan and the requirements and the contributions and all of those pieces are really at what the mentor is providing for the career of the AI. Yep.
So on the website, you do have a template.
On the website, we do have a template
for
the mentoring plan, but it's not right now under the ACE Awards. I think it's only under the MRDA and the Pilot Awards.
We'll make sure that's
so we just have to make sure that it gets up. So just this instant it's not, but soon it will be.
Yeah.
So the core will help you to identify the mentor if you do not have.
The mentoring core can help you to identify mentors if you don't have any mentor, and the core can also help you identify additional mentors if you have a good career mentor for your main career, but you don't yet have someone who can help you navigate the waters of community engaged research.
So you do have a pool of experienced investigators.
We have a small pool of experienced investigators and a broad viewpoint of how to create a group that will fulfill the needs.
Community-based research.
Yes.
The other thing is, do you have to specify the time commitment for the mentor and mentor?
So yes, do we have to specify time commitments? Absolutely. I mean, saying you're going to do something, yeah, okay, fine. No. We need to know how often you're meeting and what specific skills and things the mentor is doing. What are they going to read? What are they going to design? What are they going to teach you? How often are they going to meet with you? How often are they going to go out into the community with you if that's important? Are they going to help moderate meetings with community members if those are tricky? Any of those sorts, yeah, so absolutely not only 2 hours a week, but a reasonable description of what's going to happen, how the mentor is going to be spending the time that they're spending with the mentee around this award. Anything else?
Is funding being provided for the mentors through the grants?
Is funding provided for the mentors? I do not think so through the ACE award. For the MRDAs, yeah, the ACE award does not, because it's such a small. For the MRDAs, the mentors get $2,200, which is given to the mentors unless they're on the mentoring committee, in which case we feel there's a conflict of interest, or perceived conflict of interest. Yeah, great.
Thanks, Sue. Okay, last thing. Kristen reminded me that there are evaluation forms for this meeting. Some of you have them in paper in front of you. We'll also email them to everybody that's signed in, as well as attended via the phone or Blue Jeans. So please complete those at your behest and get those back to us as soon as possible.
If you email them, will they be electronic? Yes. They're in red cap. Most excellent, because I'm doing it that way now.
Yeah. They'll be in a red cap survey form. So that being said, last opportunity for questions or comments, gripes, anything?
Related to ACE or
Oh, okay. Well, we could be a sounding board. All right. Well, I want to thank everybody on behalf of the folks that are working on the ACE Awards, as well as the Excel program. Thanks for attending, and we hope to see all of your applications and help you do the best that you can to engage in meaningful community-based research. Thank you.